Hey everyone. So we're gonna do like a review for quiz number three for those that have been Patho. So in case you're not aware, we're gonna take quiz number three. So Dr. Akeo actually prepared all the concepts listed on the announcement. So I have the list right over here. So we're just gonna go each item that's listed. So one of which is the difference between positive feedback and negative feedback. So, in positive feedback, the response to the stimulus increases the synthesis and secretion of hormone. And negative feedback is when the response to the stimulus decreases the synthesis and secretion of hormone. So, she gave you a couple of examples. So, for positive feedback, just think of giving birth. And for negative feedback, just think of insulin and sugar. She also brought up, so if you're on the Zoom meeting, she brought up the baking cookies, adding the ingredients and such. So be sure to remember that. It's not okay. It's not. I'm gonna mention some things that are not really on here, but I feel like it's very important to know. So, for instance, we have upregulation and downregulation. In upregulation, the low concentrations of hormone increases the number or affinity of receptors, whereas downregulation is when the high concentration of hormone decreases the number or affinity of receptors. So I'm not sure how to remember the down, but for the up regulation, just think of Michelle Obama. I hope you know what I'm talking about. The quote: "When they go low, we go high. When the concentrations go low, the receptors go up." So that's one way to remember the up regulation. Okay, and then one another thing that she mentions is the ADH. So some of the disorders that relates to ADH. So first of all, I just want to know, I just want to share what ADH is. So, it is a hormone secreted by the posterior pituitary gland to prevent the kidneys from expelling too much water. So, one medication and form of ADH is vasopressins, which is the main job is to retain water and to control plasma osmolality. So, there's like a couple of conditions that are related to ADH, such as the syndrome of inappropriate antidiuretic hormone secretion, or SIADH. This is caused by having too much or the hypersecretion of ADH. It's usually caused by ectopic production of ADH by tumors, pulmonary or CNS disorders, surgeries, or medications. And then there's some clinical manifestations. So it's usually hyponatremia, and it's usually determined by how severe it is. So if you have low levels of sodium, then it could be problematic. And then we also have diabetes insipidus. So diabetes, we're gonna discuss about that later on. But for diabetes insipidus, it's caused by having not enough or hyposecretion of ADH. Now, when you think of diabetes, you think, oh, okay, it must be sugar related, right? But later on, you'll hear more about diabetes mellitus that's involved with sugar. But for in this case, with diabetes insipidus, it doesn't usually involve with the sugar. And then, in addition, it the diabetes insipidus it leads to loss of too much water in urine, and then some manifestations include polyuria. You know what polyuria is, right? Poly, many, excessive, urea, urine. Get it? Okay. Nocturia, urinating at night, and polydipsia. What's polydipsia? Poly is many, dipsia is thirst, so excessive thirst. So there are two forms of diabetes insipidus. You have neurogenic and nephrogenic. So neurogenic involves with insufficient amounts of ADH, whereas nephrogenic is an adequate response to ADH. Okay, so then we have the parathyroid glands. So those are the small glands located behind the upper and lower poles of the thyroid gland. So what does it secrete? The name itself, parathyroid hormone, PTH. What does it do? So it increases serum calcium and decreases serum phosphate. So calcium and phosphate, they go inverse. Okay, so we know parathyroid hormone it does increases calcium. So there's an arch enemy. It's called calcitonin. So calcitonin actually interacts with parathyroid hormones by decreasing the blood calcium level. So parathyroid increases blood calcium. Calcito lowers the blood calcium. So just think, parasite makes it high, calcito makes it low. So let's do a little exercise, all right? So this is parasite, this is calcito. Ready? Okay. Good job. All right. So, so in terms of the parathyroid, so what vitamins is needed in order for the parathyroid hormone to function properly? So it's vitamin D. Just remember that vitamin D. You need vitamin D for in order for that parathyroid hormone to function correctly. And then you have the thyroid gland. So it's an endocrine gland that surrounds the trachea and the neck. So it's more forms like an isthmus. So like an island where it's like tiny tubes. Yeah, that's an isthmus. And okay, so the thyroid, of course, it secretes two different types of hormones. You have the thyroid hormone and the TSH, the thyroid stimulating hormone. TSH is just self-explanatory. It just stimulates the thyroid gland. And the thyroid hormone is responsible for the growth, the maturation, and functions of cells and tissues. And it also does function of blood cells and muscle tissues and such. So what does TSH, thyroid stimulating hormone, comprise of? So it's thyroxine or T4 and oh goodness gracious, triodothyronine, triodis, triod, triodothyronine. Okay, but just to know that's T3. So you have T4 and T3. Good luck pronouncing this T3. Okay, so what does T4 and T3 do? So they control the energy levels, internal temperature, hair, skin, and weight. Hypothyroidism. So this is another concept here. So hyperthyroidism versus hypothyroidism. So hyperthyroidism is a condition in which excess amounts of thyroid hormones are secreted from the thyroid glands. So conditions could be thyrotoxicosis, Graves' disease, goiter, and thyrotoxic crisis. Ooh, my goodness. So you might want to know those terms. So thyrotoxicosis, so that's a condition that results from any cause of increased TH levels that can result from dysfunction of the pituitary, the thyroid gland, the ectopic thyroid tissue, or the ingestion of excessive amounts of thyroid hormone medications. Graves' disease is an autoimmune, okay? Graves' disease, autoimmune, okay? So it's an autoimmune disorder that's caused by hyperthyroidism and it's characterized by goiter and or exo exophthalmosis, like bulging eyes. And you have the goiter, so that's enlargement of the glands. Thyrotoxic crisis, that's a rare but dangerous worsening of the thyrotoxic state in which the thyroid hormone level rises dramatically and death can occur within 48 hours without treatment. So if you have that, or if someone has that, you have to get it treated right away. So what are the manifestations of a thyrotoxic crisis? You have hyperthermia or heat tolerance, you have tachycardia, you have heart failure, agitation or delirium, NVD. So NVD is, oh goodness gracious. Okay, NVD is nausea, vomiting, diarrhea. Medical terminology. You must know that. And then of course weight loss. So there's another type of hyperthyroidism known as secondary or central hyperthyroidism. So that's caused by TSH secreting pituitary adenomas. So those tiny little growths, very annoying growths. And then you have hypothyroidism. Hypo, deficient of production of the thyroid hormone by the thyroid gland. So you have primary and secondary. So primary involves loss of thyroid function. It's caused by autoimmune thyroiditis, loss of thyroid tissue, medication, and endemic iodine deficiency. So just a lack of iodine causes hypothyroidism. And then you have the central hypothyroidism. So that involves the failure of pituitary glands to synthesize adequate TSH, and it's caused by pituitary tumors and associated treatments. Some treatments might cause that. So just like you know. So manifestations of hypothyroidism, so you have decreased metabolic rate, cold intolerance, so you cannot handle the cold, and lethargy. So it's just basically sluggish, you're feeling sluggish, feeling a little bit sleepy. And then within the hypothyroidism umbrella, you have Hashimoto thyroiditis. So it's the autoimmune disease causing a gradual destruction of the thyroid tissue. And then you have congenital hypothyroidism. So it's a condition caused by congenital absence of atrophy of the thyroid gland. So it's usually when you're at when it's involved in the infant stage and there's not much thyroidism going in place. So that's hypothyroidism. Okay, so I mentioned earlier about diabetes. So here's diabetes mellitus. So it's the metabolic disease characterized by hyperglycemia. What's hyperglycemia? Come on, come on, come on. That's right. Excessive sugar in the blood. And it results from defects in insulin secretion, insulin and insulin action, or possibly both. So that's how we have the three main categorizations. You have type 1, you have type 2, and you have gestational. Type 1 is most common in pediatric chronic disease. Oh, it's most common pediatric chronic disease. So it usually occurs in younger individuals for type 1. So it involves immunology mediated beta cell destruction and apoptosis, in which 80 to 90% of beta cells are lost. So, in addition, you have insulin synthesis declines, and because of that, you have hyperglycemia. That's what happens. So again with the insulin, so it may cause alterations to the insulin, amylin, and glucagon, and of course some genetic and environmental factors are involved. So there's actually two types of type 1 diabetes. So diabetes mellitus, type 1, type 2. Type 1 has two types: idiopathic and autoimmune. So idiopathic, so it's deficient in insulin but no pancreatic cell damage. It's genetic, can be inherited, and there's no evidence of autoimmune activity against the beta cells. Whereas autoimmune, type 1 diabetes, so we have slowly progressive autoimmune T cells mediated. It's a T cell mediated disease that destroys the beta cells of the pancreas. Oh, okay. So what are the manifestations of type 1 diabetes? So you have hyperglycemia and the polydipsia, polyuria, polyphagia. Come on, you must the three main polys. You must know them. Come on. Then you have weight loss, fatigue, and recurrent infections, and prolonged wound healing. And then for this type 2 diabetes, you have characterized as decreased insulin secretions by the beta cells. So this is genetic environment interactions involved. So this is later loss of beta cells, causing deficiency in the insulin activity. All right. So what are the risk factors? So age, family history, hypertension, obesity, physical inactivity, and poor nutrition. Manifestations of type 2 diabetes includes fatigue, pruritus, how you pronounce it? Okay. Recurrent infections, visual changes or symptoms of neuropathy, weight gain or being overweight, being dyslipidemic, and being hypertensive. So, right. So, how do you distinguish between type 1 diabetes and type 2 diabetes? So, to sum it up, type 1 diabetes involves deficiency of insulin. Type 2 diabetes involves with insulin resistance. So, I would use this type of mnemonic. So, just think type 1, not done. Type 2, F you. Okay, I'm going to explain more about the mnemonics. So, type 1, not done. So, remember, type 1 diabetes is when there's not enough insulin, it's just depleting. So, if you're pretty much don't have enough insulin, then you're basically not done with the development of insulin. So, type 1, deficient in insulin, so therefore the level is not done. So that's why type 1, not done. And then type 2, FU. Okay, John, why? Okay, so type 2 is when now you have insulin. You have so much insulin that suddenly the insulin just becomes so massive it just like refuse anything. So it's like resistant. Type 2 is resistant. So you can try to add some things, add some medications. It's like, you think you're gonna kill me? F you, F you, F you. So yeah, so that's basically the insulin talking. So that's why type 2 F you, because it's being resistant to anything. So it's like, F you, F you. So just remember that. All right. And then we have gestational diabetes. So that's any degree of glucose intolerance with onset or first recognition during pregnancy. So just think gestational diabetes involves with pregnancy. What are the acute complications of diabetes mellitus? So hypoglycemia. hypoglycemia, hmm, low blood sugar, right? Diabetic ketoacidosis, and then hyperosmolar hyperglycemic non. Oh goodness gracious! Hyperosmolar hyperglycemic non ketotic syndrome. HHNKS. There. So again, hypoglycemia, low sugar. Okay. So what happens in diabetic ketoacidosis? So that's when the glucose is not available and the fat is used instead. And then now you have these byproducts known as ketones. That's how they got the name diabetic ketoacidosis. So what happens in HHN? Oh goodness gracious, HHNKS. So the blood sugar level rise. The body tries to get rid of the excess sugar by passing it through your urine, and then now you have excessive urine production, which results in dehydration and increase in thirst. So you get thirsty because you're pushing out through all the urine, and then now you're like, I'm thirsty. Okay. So any complications of diabetes mellitus? So we have microvascular, macrovascular diseases, and then infection. So the microvascular diseases. So you have diabetic retinopathy, the damage to the retina, the eyes, diabetic nephropathy, so that's damage to the kidney, and diabetic neuropathy, that's damage to the nerves. Medical terms, gotta know it. And then for the macrovascular disease associated with diabetes mellitus, you have cardiovascular disease, cerebral vascular accident, and peripheral vascular disease. Okay, that's, oh my goodness, that's a lot for diabetes. So, let's see what else. We have the superior vena cava syndrome. Okay, so this is the bronchogenic cancer followed by lymphomas and metastasis. Jesus, metastasis of other cancers. What are the less common causes of superior vena cava syndrome? So you have tuberculosis, mediastinal fibrosis, and cystic fibrosis. So superior vena cava syndrome, it's an oncological emergency. So how can it be treated? Radiation therapy just to remove the tumor, and you have surgery and chemotherapy, which also can help. All right, and then you have varicose veins. So that's a vein in which the blood has pulled, which produce distended, tortuous, and palpable vessels. So if you were to see someone with varicose veins, it looks kind of purplish, like purple veins, like spider veins. It's the same bit. Okay, so what are risks of varicose veins? So age, wear and tear on the valves, female gender due to hormones, family history, obviously the additional stress on the vessels. So that's why you have to try to be active. Yeah, cool. Okay. Pregnancy due to hormones, deep vein thrombosis. So that's gonna complicate the varicose veins, and then prior leg injury, in which the valves are damaged. And speaking of deep vein thrombosis that I just mentioned, so what's deep vein thrombosis? It's a formation of a blood clot in a vein deep in the body, most commonly the leg. Okay, so I don't think Dr. Akeo will ask you of what causes deep vein thrombosis or even what is deep vein thrombosis, but I just want to add a little amp that's gonna amp it up a bit. So hopefully you, I don't know the concept, understand the concept. So what are the key factors that associate with the thrombosis? So for instance, deep vein thrombosis. So you have venous stasis, which everything stays. It just froze. Hypercoagulability, that's when it flows the cloudiness, the stickiness, and then of course, which leads to venous injury. And then you have thrombosis. So I just remember the mnemonic. I'm going to spell it out. I'm not going to say it. SHIT. I'm just going to spell it. I'm not going to say it. So S for stasis, H for hypercoagulability, I in injury. All leads to T, thrombosis. So just remember SHIT. So the the factors that affect thrombosis, it's known as the Virchow's triad. So just a little something, some information to digest through. Okay. So you have the coronary artery disease. So that's any vascular disorder that narrows or occludes the coronary arteries, leading to myocardial ischemia. So what's the most common cause of coronary artery disease? Just know that it's atherosclerosis, and that is a form of arteriosclerosis. So that's hardening of the arteries that is caused by an accumulation of lipid-laden macrophages with arterial wall, which leads to the formation of a lesion called a plaque. So that yellow stuff that's like protruding, it's called a plaque. Right. So what are the non-modifiable risk factors of coronary artery disease? Coronary artery disease. So increased age, family history, male gender or female gender post menopause. So mainly if for the female gender that undergo menopause, that could be one of the risk factors. Modifiable risk factors of coronary artery disease. So you have dyslipidemia, hypertension, cigarette smoking. Don't smoke, you guys. Never ever smoke. And you might want, and if you vape too, you might want to cut that out as well. So you have, in addition, diabetes mellitus and insulin resistance. So again, type 1 and type 2. Type 2 involves resistance. Type 1 involves with less insulin. Just make sure, right? Okay. And then you have obesity and sedentary lifestyle. So yeah, please be active. Be like me and go run up the park or somewhere. At least 30 to 60 minutes would help. And then the atherogenic diets, so food that promotes inflammation and plaques on the inside of the artery. So avoid oily foods, avoid red meat. I know it's so good, but please just cut it out. And then you have the non-traditional risk of coronary artery disease. So a lot of interesting terms. So adipokine, so that contributes to obesity and inflammation, chronic kidney disease, certain medications such as stimulants and opioid drugs. Okay, all right. So transient myocardial ischemia, that's part of a coronary artery disease. So this refers to a temporary deprivation of the coronary blood supplies. Just want to make sure you know that one. So what develops the myocardial ischemia? So it's the flow of oxygen content of coronary blood is insufficient. So not enough oxygen to meet the metabolic demands of myocardial cells. So that's, and then you have the coronary spasms, hypertension, and dysrhythmia that are associated with it. Clinical manifestations of transient myocardial ischemia. So you have stable angina pectoris, prinzmental angina, and then the silent ischemia. So stable angina, so that's a type of cardiac chest pain that is a result of ischemia that's initiated by the increased demand and activities such as exercise and stress. So it's good to have exercise, but don't overdo it. And of course, stress is not good. And then it could be relieved by rest. So of course, we need to rest. If you're stressed out, breathe. And if you exercise, just again, have a water. If you have cramps, eat a banana. Okay. And then you have silent ischemia angina. So that's ischemia without the patient reporting the pain. So it's a silent. It's like silent ischemia. The patient doesn't even know it has. And then the primary cause of abnormalities in the autonomic innervation, most commonly associated with diabetes mellitus. Okay, so that's that. And then you have the prinzmental angina, so chest pain attributable to transient ischemia of the myocardium that occurs unpredictably and often at rest. So you have the vasospasm involved. So vasospasm in the heart arteries, it reduces the blood flow because so unstable angina results from reversible myocardial ischemia, such as a partial rupture of an artery. And that's when the heart doesn't get enough blood flow and oxygen. Myocardial infarction, so that's the extended obstruction of the myocardial blood supply. So that causes which causes myocyte necrosis. So the heart muscles kind of dies off in myocardial infarction. All right. So you have STEMI and non-STEMI. STEMI, distinct acute heart attack. Non-STEMI is like old heart attack. So non-STEMI is just like it's already in the past. It's not going to be as severe. Whereas STEMI, it's like it's fresh. It's off the bench. It's off the oven, hot and fresh. Okay, so let's see what we have here. Manifestation of myocardial infarction. So sudden severe chest pain, it may radiate. Then you have the nausea and the vomiting and the diaphoresis. Diaphoresis is like excessive sweating, and dyspnea, hard time breathing. And then, all right, so myocardial complications. So Complications include dysrhythmia, left ventricular failure, pericarditis, organic brain syndrome. That's a whole list, and even sudden death is also one of them. Then you have rheumatic fever. I think rheumatic fever is in the list. Yeah, it's in the list. So it's a systematic inflammatory disease caused by a delayed immune response to the pharyngeal, by a delayed immune response to the pharyngeal. Did I say pharyngeal already? Okay, let me try again. So rheumatic fever, it's such a systemic inflammatory disease caused by delayed immune response to pharyngeal infections caused by the group A beta hemolytic streptococcus. Okay, so the streptococcus pretty much caused this. I'm sure there's like a billions of streptococcus organisms floating around, but so which one, which specific streptococcus involved with this rheumatic fever? Remember this. It's Streptococcus pyogenes. Yeah, I'm just being specific. Streptococcus pyogenes. Remember that. That's what causes rheumatic fever. And then you have febrile illness. So that's inflammation of the joints, skin, nervous system, and the heart. So I think that's associated with rheumatic fever. And if it goes untreated, so this is also on the list of concepts that you have to study for quiz number 3. So if rheumatic fever goes untreated, it can cause scarring and deformity of cardiac structures, which results in rheumatic heart disease. So we need some prevention going on here, otherwise it might progress to something worse. Okay, then the manifestations. I'm just gonna list a few because there's a whole lot, and I don't want to overload you guys because it's a quiz. It's gonna be super super short. Okay, so we have lymphadenopathy, arthralgia, nausea, vomiting, and abdominal pain, tachycardia. Okay, clinical manifestations. Okay, you can. Okay, one of which is subcutaneous nodules, carditis, polyarthritis. So what happens in heart failure? So that's when the heart is unable to generate adequate cardiac output. Okay, so what contributes it? It's an adequate perfusion of tissues, increased diastolic filling pressure of left ventricle, and pulmonary capillary pressure increases. Left-sided and right-sided. That's another thing that's going to be on the quiz. So on the left-sided, so we have heart failure with reduced ejection fraction, systolic heart failure, or heart failure with preserved ejection fraction. So it's either one. So it's reduced ejection fraction and preserved ejection fraction. So that's diastolic. Systolic heart failure, so that's an ejection fraction of less than 40%, and it's an inability of the heart to generate an adequate cardiac output to perfuse the vital tissues needed. All right, cardiac output. So that's the amount of blood ejected from the left ventricle each minute. So there's going to be an equation. I'm not sure it's going to be an equation on the quiz. Just think cardiac output is the product of heart rate and stroke volume. Stroke volume is the amount of blood ejected from the heart in one contraction. And then there are 3 determinants. You have contractility, preload, and afterload. Okay, manifestations of left-sided heart failure. You have dyspnea, orthopnea. So that's an inability to breathe while lying down. You rather be breathing when you're standing up. Okay, fatigue, edema, decreased urine output. All right, so S3 gallop you might see in the EKG reading for left-sided failure. All right, so let's go to the right-sided heart failure. So it's an inability of the right ventricle to provide an adequate blood flow into the pulmonary circulation at a normal central venous pressure. Okay, it's most commonly caused by diffuse hypoxic pulmonary disease, usually COPD, cystic fibrosis, and acute respiratory distress syndrome, or ARDS. Okay. So, okay, EKG. So, I think one of which is you have to understand what's happening to heart during the QRS complex. But I'm just going go over the P wave, the QRS complex, and the T wave. P wave, you have atrial depolarization. QRS, you have ventricular re, wait, trend. Let me try this again. For the P wave, you have atrioventric. Wait, holy cow. Okay, let me try this again. So P wave, atrial depolarization. QRS complex, ventricular depolarization. T wave, ventricular repolarization. So another mnemonic to remember. So again, P wave, atrial depolarization, PAD, all right, PAD, PAD, QRS complex, ventricular depolarization, Queers video, QRSVD, Queers video. And we have the T wave. The T wave is ventricular repolarization, TV remote. Remember that. All right. So we're gonna go over a lot of shocks. Shocks. So what happens in a shock? So that's when the cardiovascular system fails to perfuse the tissues adequately, resulting in widespread impairment of cellular metabolism. So yeah, there's a whole variety of shocks. You have septic shock. You have a whole lot of shocks. Shocking, right? But anyways, seriousness aside, so I think one of the things that one of the concepts that you want to study is the anaphylactic shock. So that's anaphylactic shock is another name for, you guessed it, allergic reactions. All right. So in anaphylactic shock, so it results from a widespread hypersensitivity reaction. Again, it's known as allergic reaction or known as anaphylaxis. So that's a terminology, fancy terminology that you must know. So let's see the what else we have here. Okay, so common items that can trigger anaphylactic shock: insect venoms, shellfish, those that are allergic to peanuts. It's been an ongoing issue with people allergic to nuts. Peanuts, cashews, tree nuts. So if you see a food item that says processed from tree nuts or a factory that produces nuts, avoid them. You might get some anaphylactic shock, and that's not going to look good. So, primary clinical and manifestations of anaphylactic shock. So, you have abdominal cramping, anxiety, difficulty breathing, dizziness, hives, or urticaria, urticaria, whatever, hives, stridor, swollen lips and tongue, and wheezing. So, those are the clinical stuff. Okay, and then we have burgers and Raynaud. I know this is part of the cardiovascular. I'm kind of like jumping around. But hey, it's in the quiz. It's gonna be in the quiz. You might want to study those. So we have to know the difference between Raynaud's and Berger disease. So in Berger disease, also known as let's call it Berger disease. Just for the sake of it, damn it. So autoimmune disease of the peripheral arteries, strongly associated with smoking, characterized by the formation of thrombi filled with inflammatory and immune cells, and then the thrombi, those clotting cells. So they become organized and fibrotic, which results in permanent occlusions of portions of small and medium-sized arteries in feet and hands. It causes pain, tenderness in the affected area, and can often lead to gangrenous lesions and amputations. So that's when the certain regions turns black and then it falls off. Sounds so sad to say it falls off, and then it has to be amputated. Whereas for Raynaud phenomenon, so that involves attacks of vasospasm in the small arteries and arterioles of the fingers and less commonly the toes. So you have primary and secondary. So primary Raynaud phenomenon, so a common vasospastic disorder of the unknown origin, and then you have secondary Raynaud phenomenon, so associated with systemic diseases, particularly collagen vascular disease or scleroderma, vasculitis, malignancy, pulmonary hypertension, chemotherapy, cocaine use. Don't do drugs, kids. Don't do drugs. Don't do the batu. That's what we here in Hawaii would say. All right. Where was I? So hypothyroidism, thoracic outlet syndrome, trauma, serum sickness, or long-term exposure to environmental conditions such as cold temperatures. So if you're in a cold temperature, you might want to avoid that area as soon as possible. And vibrating machinery, who cares? Okay, so you might want to know the appearance of Raynaud's. So it involves three colors showing up on your hands. It will be white, it will be blue or cyanotic, and it's going to be red or ruber. White, if it's white, it might show vasospasms. It'll be blue, and if there's like sluggish blood flow, which results from the ischemia. So just think ischemia is the one responsible for the Raynaud's disease. So again, pallor, white hands, vasospasms. Cyanosis, cyanotic, blue, you have sluggish blood that's caused by ischemia. And of course, presence of hypoxemia. And ruber is there's blood flow. So it starts off white, a little bit pale, and then the blood is not really that fast, not that rapid. So that's how we get the blue stuff. And then the ruber is when, okay, back to normal, all red. But if it's too red, then something's up. And it could be a possibility that you can have all three colors onto your hand. So I just think of it like Raynaud's, Russia. Hands of Russia. Russia hands. Because Russia's, it goes like white, pallor, blue, cyanotic, red, ruber. So I just think Russia because of the flag, how it was organized. You can use France. You can use US. Although it'd be weird of how you can have stars, white stars on your hands. It could be a possibility. Who knows? What are the odds, right? So for me, I just think R. Raynaud's, Russia hands. So I guess that concludes pretty much everything on the list. So, yep, that's pretty much everything. And yes, there's gonna be a Quizlet attached to it. So just look for the link on this YouTube video. Check it out, and I'll just wish you guys luck on quiz number 3. So it's gonna be. I know I presented a lot, but when it comes time for the quiz, it's not gonna be as painful because hey, you learn all the information, and whatever I say or whatever's on the lecture or whatever's on the concept list, it's gonna be on the quiz. So hope this helps, and good luck with quiz number 3. All right. Good luck, y'all. Good luck.